Hello, my name is Carolynn and I'm a professional artist and an art teacher here in the North Bend Coos Bay area. And what I'd like to share with you today is a very personal story to me, and one I feel should really be told, and a story of hope. And it started about 4 years ago, and I was going through my middle age, and I still am, but so I decided to have a facelift. Some people tried to talk me out of it, said, oh, it wouldn't be any good, and others said, oh, go for it. And I had saved up my money, and I went for it. And I came out of surgery, and a few days passed, and my left eye, the lower part of my left eye wouldn't go back up into position. And 4 surgeries later, and it still wouldn't go back up. In fact, it got worse. Now, I'm a professional artist, like I said, and my eyes are very important to me. And I started painting portraits of women that only had one eye showing, and that eye that was showing was an eye that was hurt and devastated. This particular painting is what I call a semi-abstract, and it has to do with wishful thinking, or it has to do with prayer, praying that something will happen to heal, once again, the eye. This particular painting is called Stoic. As you can see, she is, actually it's a person that's rather in shock that things didn't work out the way she thought they would, but she's trying to keep her chin up, and at the same time there again is the eye. This particular painting was done in a monochrome, which basically means one color with tone values, and it was done in a deep blue because of the depression aspect that I was in at the time, and with my eye. And you can see how this was the eye here. She is the trapeze artist over here. It's a matter of trust that they hold on to each other, but she's lost complete trust. For 4 years, every day I paint every day. I picked up the paintbrush and I painted all my anger and my pain. And 4 years later, after I had the operation with Dr. Markelov, I sat at home and I looked around at all my paintings on my walls, and there I was. There was the pain, there was the depression, there was the anger, all these portraits of women with their one eye showing and in pain. When I woke up out of that surgery, and a few days later, and I noticed I had no tears running down my face, I was so happy. I was so happy. I thought that maybe it was just a fluke. Maybe it was going to go back to the way it was. It never did. And I thank Dr. Markelov for that. And I thank myself that I had the courage to go forward and to get with another doctor and to see. And I hope if anybody is going through something like that, that they certainly get with Dr. Markelov.